Hi, my name's Emma. I'm the neonatal product specialist at Eakin Healthcare, and today we're going to talk about humidified resuscitation. Humidified resuscitation refers to the gas that's being delivered to the baby through a TP system, being delivered with warmth and added water vapour, whether initially in the delivery room or if that baby requires it in the neonatal unit. It will be similar to what's done with respiratory gases delivered by invasive ventilation or CPAP and high flow therapy in the neonatal unit. Why not? The gases delivered to the babies needing acute respiratory support in the ward are always humidified, and we wouldn't think of delivering them in any other way because we know that cold and dry gases will have a big impact on the lung function of those tiny babies and the ability to easily clear their secretions. But not only that, a key advantage of using humidified gases to stabilise a preterm baby in the delivery suite is the ability to maintain core body temperature, which has been the most extensively studied benefit. Most very preterm babies will need some form of respiratory support to help them transition. Often PEEP is used, even if that baby doesn't need inflation breaths, and that PEEP will be delivered with a standard T-piece resuscitation circuit. That means that all these preterm babies are being exposed to cold and dry respiratory gases as their first form of respiratory support in their initial first breaths. Alternatively, when a humidified resuscitation circuit is used for stabilisation after birth, it has been demonstrated in clinical trials that the humidified gases help to maintain body temperature and therefore resulted in reduced instances of hypothermia, and more babies show an improved NICU admission temperatures within that recommended range of 36.5 to 37.5 degrees Celsius. With the knowledge of how important NICU admission temperatures are as an indicator of babies' outcomes in terms of mortality and morbidity, it's so important to take measures to maintain body temperatures within the recommended guideline range. All hospitals will have procedures to help maintain body temperature, and they will use tools like skin-to-skin care, the use of plastic bags or wraps, and the use of radiant warmers to stop babies getting cold. Humidifying the respiratory gases is another valuable asset. It's an added measure that can be taken to really impact admission temperature positively while providing additional benefits for ongoing lung function. Providing humidified resuscitation gases in the delivery suite is as much the same as providing it in the neonatal ward. We add a heater humidifier to the equipment setup, which will add the heat and water vapour to the gas flow from the resuscitator. Alongside that, we use a specialised circuit that includes a heating element to ensure that the gas we've heated and humidified stays humidified as it travels through the tube into the baby. For most labour wards and delivery suites, a humidifier can be added to the side of the radiant warmer or mounted close to the resuscitator on a receiving platform or trolley. Changing to a humidified resuscitation circuit that includes the humidification chamber and the heating lid, when attached to the humidifier, will work alongside the existing resuscitation equipment, meaning implementation is simple. Support can always be provided by the company you purchase it from. Overall, the steps that are taken to stabilise a preterm baby needing respiratory support will remain the same. The equipment used to control the pressures and deliver the gases won't change, whether that's a built-in resuscitator as part of a radiant warmer or a standalone resuscitator mounted onto a receiving area. The functional T-piece circuit will look like the standard type, and delivery of PEEP and inflation breaths will also not change. A dial to control PEEP and a bleed hole to deliver the breaths will still be present, and it will look exactly the same as what midwives, neonatal nurses and doctors are used to. The staff using the humidified resuscitation circuit will still set the pressures in the same way and follow the same guidelines for stabilising the baby and delivering respiratory support if required. The only change to practice is before the baby enters the equation. Staff would turn on the humidifier and connect the heated circuit to the humidifier to ensure the gases the baby is receiving are humidified. This is simple to implement, and it can all be successfully achieved through training and support from your manufacturer. If you have any questions, queries or comments, leave them in the comment section below, and please visit our website where you can learn more about humidified resuscitation and our entire NeoFlow range.